the final session of the workshop on a policy workshop on COVID-19 and the challenges faced by the law enforcement agencies in South Asia. The final session will be looking into the way forward, an agenda for security sector governance towards improving law enforcement, accountability and professionalism for future and even current health crises. As we all have been discussing, that at the core, the COVID-19 pandemic is a public health crisis, but its implications are both wide-ranging and far-reaching. And the value of democratic governance lies in addressing not only the current, but also the emerging security challenges. Unfortunately, this pandemic has brought about development that complicates the provision of human and national security within the democratic governed, accountable and effective security sector. Also, the reality is that pandemic do not affect everybody equally, but disproportionately impact the most vulnerable and underrepresented groups. We have also realized during our discussions over past 3 days that an over-securitized response to pandemic can both violate people's rights and be manipulated to serve political agendas. It is important to highlight abuses by security forces in response to COVID-19 and imperative that they be held to account. Equally, it is important to recognize the crucial role that the security sector has played in responding to COVID-19, and especially the benefit when it works together with local community and civil organizations. There is much debate about whether the mode of lockdown to stem out the spread of virus is the right way, but it has been also realized in the discussions during these days that if restrictive measures are imposed, but people have no way of obtaining income or food, rules will be inevitably broken and conflict will arise. And the trust between state and society will be further undermined, especially in the context of South Asia, where the public is expected to comply with government restrictions such as stay-at-home orders or ban of mass gathering. These all should be achieved by engagement, trust building and consent, rather than by threat, denunciation or force, which perhaps means that compliance through trust rather than cohesion, as we have been discussing in the workshop, and building the legitimacy of police as a service rather than as a force might be the way to approach these efforts. We also in the previous session heard that how the community-oriented policing and public outreach initiative that police has undertaken may be useful alongside with wider government, the whole of government's efforts to collaborate with different sectors, community-based organizations, religious groups, and other civil society volunteers to get the key message across to the public. Further, effective public compliance does require policymakers and implementing agencies, including the security agencies, to pay attention to different needs and impacts of security policies and measures between women and men, girls and boys. This means ensuring not only gender balance in government bodies or security institutions responsible for pandemic response, but also meaningful participation in the decision-making by women or the marginalized group in those institutions. So the longer-term question is whether these extraordinary circumstances and the response to them will further undermine public trust and expose security sector governance, or present an opportunity to build back better. So with that, hopefully our next this session will reflect on the main frameworks of security sector principles, which include participation, inclusivity, transparency, responsiveness, consensus orientation, effectiveness, efficiency, and accountability. I look forward to all the presentations and also the interaction. And with that backdrop, we will start our discussion and see how we can support the police agencies to respond and be prepared more professionally and efficiently during current and the future health crisis. We have the first presentation is by General Muniruzzaman. He's the founder of Bangladesh Institute of Peace and Security. Do we have him?
Hi, Upasana. Thank you for giving me the floor. And my greetings to everybody present in this webinar. We are talking about an issue which is of extreme importance to not only South Asia, but globally to all countries in the world. So therefore, I shall just highlight some of the issues that are pertinent to the subject that we are discussing today. And first of all, we will start with discussing how the efficiency of the police could be increased or what we have learned so far. The first point that comes to my mind is that the police was very ill prepared to face this crisis or the challenge. It was a state of surprise for most police forces in South Asia, including Bangladesh, and therefore they were completely taken aback and in the back foot. So to correct that, the best way would be for police forces to have preparations for generic nature of pandemics. Each pandemic will have its own specificity. It will not be COVID-19 in all pandemic cases. I may also like to caution that this is not the last pandemic. We are going to have more pandemics in the future in greater frequency. So therefore, we need to prepare on a generic basis, and that preparation should be ready with the forces to meet the challenge. We also saw that there was a general lack of planning. And when a police force tries to meet a challenge without planning, it goes into operations without adequate planning. The results are not what we normally try to achieve in any operation. Therefore, there is a greater degree of need for planning in police forces. And in that planning process, what is greatly needed is contingency planning and foresight. Both these elements have to be integrated into the planning process of the police forces for meeting health crisis, pandemic situations, and the like. It is slightly unlike the normal planning because the variables here are very, very uncertain. So there has to be a fair degree of slack in the planning process so that the contingency can be adjusted as you go about. And a high degree of foresight planning is needed into contingency planning here. The next point that I want to mention here is that once the police was involved, they tried to involve on an ad hoc basis. What we want the police to do is to do a proper threat analysis of the crisis that they're going to meet the challenge. So in the case of the COVID-19 case, there should have been a better understanding of the COVID-19 situation, do a proper threat analysis, and then find out exactly how the response mechanism should work out. In the future, we need our police forces to do more field training for increasing their efficiency. In this case, we have seen that hardly any police force in South Asia did any field training for health crisis or pandemic situations. And in some cases, some rudimentary planning process papers were available, but they were never implemented on the ground in the form of an exercise. So I would suggest that we need more, not only planning process, but we need to implement them for training purposes, for field training, more simulations. Simulations could be computer-based, could be on tabletop exercises, and we need more scenario planning because all the situations are evolving all the time. So we need to have planning for multiple scenarios. One size will not fit throughout the crisis. So we need to work on multiple scenarios as you go about training our police. In most cases, including Bangladesh, we saw a general lack of equipment. The equipment was in general in nature in some cases, and more crisis-related or pandemic-related equipments that are necessary with the police was not available. So our procurement process, our acquisition process needs to be re-evaluated to meet the challenges of meeting the special needs and the special circumstances where we want to involve our police. For example, the police, once they were inducted for the crisis response, did not even have its own self-protection gears. So those are the situations that we must foresee in advance and try and prevent. We saw a general lack of a national strategy into which the police force could then go and fit in. The police role in pandemics or health crisis cannot be in isolation. It is part of a national plan and a national strategy. But in many cases, including Bangladesh, we saw that there was no national strategy where the police could go and fit in. So we saw in many cases they are working independently, in many cases on ad hoc basis. So we don't achieve much when we operate in that manner. At the same time, since there was no national strategy, we also did not find a national legal framework to operate in this kind of circumstances. So there is a need not only a legal framework at the national level, but that legal framework in its implementation has to be also trained with the police so that the police is aware of the legal rights, frameworks, and their obligations. In many cases, we saw in Bangladesh that there were hotspot areas for which police response was needed. In some cases, those responses were done by the general nature of response by the police. But what is needed here is that we need a quick response or emergency response, small teams that could be deployed very quickly and very efficiently. And for that, we need a different kind of team building. We need a different kind of equipment and mobility, and we also need different kind of planning. There is still a general lack of interagency cooperation at the level of the security sector, at the level of the security sector and the national sector. So we need to see all the capacity with the security sector and also at the national level, and must find out how all these agencies could cooperate with one another to build a comprehensive plan of response. There is also a lack of information sharing, both at the security sector and at the national sector. So therefore, I will only mention about the police, that the police must have its own information plan. And when I talk about information plan, it has to be a strategic information plan where the plan should be disseminated, shared, and those information must again be utilized for response mechanism. We have to have, with the police and security sector operating in this field, focal point personalities where people can reach out. And certainly there is a great need for spokesperson at the level of the police who could give out daily briefings or give out information for general public on for the media. There is also a certain amount of problem with policing, with the people's perception. So that perception management has to be taken into cognizance if the police has to work efficiently. I would also like to mention that the police was fairly inept in its media handling. So they wanted to hide a lot of their activities for benefit of nobody. There has to be a media policy with the police in their response to health crisis and pandemics. And that media policy must be known to the general public, to the media, and operated by the police. So for lack of a media policy and information sharing policy, we ended up with a lot of confused messaging. And that became contrary to the efficiency of the police in the field. In some cases, their intentions are good, but due to confused messaging, the results were not as intended to be. We also need to constantly see the best practices of other actors in the security sector and actors beyond the country's boundaries, so that many of those best practices and the lessons learned could then be incorporated in our operation modalities. I would like to caution here that the pandemic situation also gave rise to a lot of political use of the police for political purposes. And that became a sort of an impediment in police's function, especially as long as it went to the trust that it must win with the people. The police in many cases in South Asia do suffer from a trust deficit. And it is not only to their own fault, but also to their political masters who use them politically. And the pandemic gave a situation where, in many cases, the police were utilized by the political forces for political purposes. One of the issues that I like to mention here is that whatever we are talking here today or in the last 2 days, and whatever we are pointing out is essentially an urban experience. And that is something, that bubble has to be broken, because a pandemic is not confined to the urban space only, but much of our discussion is confined to our urban experience and our urban responses. We need to take a holistic, whole of country approach in finding out the modalities and the strategies for bringing up efficiency of the police in its response. And the last point I want to mention here is that the police was not very efficient in inducting technology in its operations. Technology is a great multiplier. It's a great efficiency multiplier. And therefore, technology must be inducted into all pandemic responses, health crisis responses, certainly of COVID-19 responses by the police. So we need to see better use of data management. We need to see better utilization of cell phone technology, drone technology, sensors, and the likes. And if we are able to integrate many of the issues that we are pointing out here, I'm certain that the police efficiency for their current operation and future pandemic operation will certainly increase. Let me utilize the last few minutes here to point out some areas where accountability should be a factor that should be addressed. And because accountability is not only for the purpose of accountability, accountability does have a direct impact on the efficiency of the police or any other security actors in their operations. And the first thing that the police must have is a greater degree of transparency. In many cases, we see that the police wants to keep everything under their own fold, but the police is a service. It's a service to the people, as very rightly pointed out in the last session by our colleague from Nepal, that it is not a force, it is a service provider. And a service provider must have a high degree of transparency to comply with. And that should bring them to a very elaborate and a wide compliance regime, which they must follow and adhere to. And that is something that is not generally seen in South Asia. We need to see evaluation in the process of their operation during pandemics, and certainly during COVID-19 situation, where their operations are constantly evaluated and then moderated for further action. Police in South Asia have an endemic problem of almost pervasive corruption. I have seen certain reports of TI or Transparency International where South Asian police forces are generally ranked at the highest of the ladder in terms of corruption perception, which is also a reality. So unless this corruption is addressed to and rooted out to a degree, if not completely, then our operations cannot improve to the degree we want them. We want a compliant handling by the police forces to meet all their compliance regulations so that their operations are transparent in the field. We have to have mechanisms for complaint lodging by the people whom they are serving. In many cases, the people they're serving are unable to reach the police forces with the complaints of their misdeeds or any of the problems that they have. So there has to be a mechanism by which they can reach their police forces in a complaint mechanisms, and there has to be a transparent way of handling them. In many cases, the complaints, if they're ever lodged is only handled by the police internally. I would suggest that there has to be an external handling procedure, because in many cases, the internal handling of the complaints by the police is mostly a sham. So therefore, that brings me to the point of a comprehensive oversight mechanism that is lacking in South Asia and certainly in Bangladesh. We not only need to have parliamentary oversight, we need to have judicial oversight, we need to have civil society oversight. So we need to have a comprehensive mechanism for oversight of the police forces and the security actors for a greater degree of accountability. There has been several complaints in Bangladesh about misuse of budget during the pandemic. And since there is a lack of budgetary oversight, so therefore these complaints have been lodged by people and in the media, and they have not been adequately addressed. So the resources or the scarce resources that are available in countries in South Asia are sometimes not geared to the right utilization to provide service to the people. And in cases where there is a lack of parliamentary and other oversight, the media should act as a safeguard for that reporting and that kind of oversight. And in many cases, whenever the media reports on a misaction by the police normally gets back to them with other means to sort of silence them. The media is not an enemy. The media is a friend of the people and of the police force, and that's the way it should be taken. The other points I would like to quickly mention before I finish my time is that there has to be a regulatory mechanisms of managing the activities of the police so that they're compliant. And in many cases, some of the misdeeds cannot be seen from outside, even with oversight. And therefore, in South Asia, we must have mechanisms for whistleblower channels so that there can be internal reporting of any misdeeds by their own organizations, and a whistleblower program should be incorporated in our national system. There should be performance audit of the police actions, actions that has to be evaluated, and an audit should be carried out on a periodic basis, and that should include human rights standards, because in many cases, police is operating in a manner that they're completely disregarding human rights in their own countries. And the last point I would like to say is that a lot of money is being pumped in by the World Bank, by the WHO, and other international organizations in raising capacity of national security actors to meet the challenges of COVID-19 and health crisis. The donor must be very, very careful in putting all the international standards of accountability for utilization of that money. With that, I would like to end my discussion here and hope to hear more discussion when we come to the Q&A session. Thank you.
Thank you, General Munir, for your presentation. Now I will request Dr. Roshan Khanijo from United Services Institute of India.
Thank you, Upasana. Firstly, I would like to thank Dr. Albert and Upasana for organizing this workshop. It was really a learning lesson, and we really shared a lot of things, and it has been very helpful. Now, coming to the last session, as far as the Government of India is concerned, they had declared COVID-19 as a notified biological disaster under the Disaster Management Act. And as in the last session, Upasana was saying that Disaster Management Act and the National Health Crisis are quite different. So a lot of legislation needs to be made in that. And Dr. Sarangi also pointed out that we need to have a comprehensive pandemic playbook. And for that, I would like to share certain pointers which may be considered when we all are making the national health policies. Firstly, health crisis has shown that the situation cannot be handled by any one agency. Hence, it is very important that cooperation among different limbs of security sector, whether it is defense, paramilitary forces, or home guards, are needed. And for that, it's essential to have a SOP kind of a thing by the relevant sectors who talk about joint operations during a pandemic, and not only with the security sector, but also involve the health sector. In India, often this sector has not been included actively, and it is not a traditional partner. Hence, it needs to be a part of the national security, as the primary responders are health workers and security forces. Secondly, the communication links need to be strengthened. Not only the internal links within the security sector, but also the external links. This is especially significant in India, as policing is a state subject, and it requires interstate cooperation, as was visible during contact tracing of persons affected by COVID. You also need to have established organizational links between health department and the police institutions to have credible channels of communication during public health emergencies. In this regard, the police can change their training manuals by involving the health experts in the faculty during the training schools, both at the center and at the state levels. Thirdly, a lot has been talked about the capacity building of the police force. It can be done in two ways. The capacity needs to be increased, we know. So either you have more cooperation with other security agencies like the Home Guard, the civil defense agencies, armed police forces, and so forth. The second is to have more police force recruited and to empower them, especially the constabulary. It is very essential to empower them and to have give them the decision-making powers, as was pointed out by Commander Sarangi. And even certain laws needs to be changed. Also, we have seen that there is going to be an increase in digital crimes. And since in future, a lot of us are going to be digitally connected, so you would require more dedicated units as far as this is concerned. We talked about gender-based violence also, and here it was felt that more women representation in the police force would help in managing the gender-based violence, as the percentage of women police officers is little less, and it should be increased both at the local level, at the lower level, as well as at the decision-making level. Thirdly, one need to amend the SOPs, or especially in terms of their training modules for the first responders. You need to increase resources and finances for police, as there was seen, as was debated in previous sessions, a gap between the expectation of the police and the resources which were available to them. You need to have a better contingency plans, both in terms of manpower, as also gadgets, various protective equipment gears, the PPEs, because it was found that often in the initial stages, the police officers went without having appropriate uniforms. So this is one area which needs to be looked into, especially now. For better response, the law and guidelines should be in place to reflect the roles, the responsibility of the security sector. And this will require integrated response and preparedness, and will give rise to additional guidelines, which we all need to deliberate. Migration again had been an issue which was discussed, and both internal and external migration. As far as India is concerned, there were nearly 11 million workers who wanted to go back to their house. And initially there were logistic problems. So a kind of SOP or something should be there, so that, and it should be shared with the relevant stakeholders at the district and other levels, as also coordination between various ministries like the transport, the railways, the aviation, and most importantly, there should be a cohesiveness between the central and the state governments. Similarly, as far as India is concerned, it shares land boundaries with various nations, also the maritime boundaries. So here also certain clear guidelines and proper coordination is required so that the movement of people and supply chains which need to be carried out is done in a very systematic way. Digital platforms have been discussed. They have played a crucial role. Hence, it is essential that the police force use not only the digital platforms for data collection, but also digitize their policing services. The experience has highlighted the importance of ICT connectivity, and this needs to be built up. The Intelligence Bureau may also have a separate department for proper digital database, monitoring and surveillance facilities, and coordinate all these with effective surveillance, and to track the various threats which one can encounter. Use of niche technologies, especially AI, may be very helpful. And as was mentioned by Dr. Sarangi, that the command and control needs to be upgraded, better radio facility, GIS-based systems, and basically technology should be used as a force multiplier. Now, role of police during the suspension of supply chain is a new area of police work. Often during lockdowns, we found that the services were suspended. So it is essential that the police take a proactive role of helping people. So their role is automatically getting changed from maintaining law and order to managing supply chains and ensuring public distribution systems during pandemic. So certain SOPs can be created in terms of which stakeholders to be utilized and which agencies are needed for the coordination at the district and village levels. There has to be cohesiveness in the security sector when it comes to distribution of essential services during the lockdown period. As was mentioned in previous sections, transparency and respect for democratic norms are very essential. Draconian laws and excessive use of force are not the solution. So a greater public security service participation and development of soft skills are required. Also, there has to be permanent parliament oversight committees and legislative bodies should clarify the new roles which police are going to play and indicate that whatever extra legal framework what they are going to be given, till what time they are valid and whether it needs to be reviewed or it needs to be expired. The focus should also ensure strong regulatory mechanisms in places to address joint integrated health crisis management. For that, a whole of government approach is required. I would like to mention especially one area, and that is the rural area. In the rural area, we have an institution called the Panchayati Raj. Now, they have been playing a substantial role in coordinating with the government in tracing, organizing health checkups, social distancing messages were sent to the local villagers, among others at the community level. So emphasis should be given to conduct research and study and review their role during the pandemic. Now, as far as bills are concerned, the legislative framework is concerned, I already told you there were few. And we had a National Health Policy 2009 bill, and also Public Health Control and Management of Epidemic, Bioterrorism and Disaster Bill of 2017, which was a very good bill, but it lapsed. So certain portions from those two bills, good articles from those bills can be taken, and a new public health legislation, that is 2020, which is going to come up, can incorporate all these things. I feel that both national health and security policy should be comprehensively reviewed within the context of this current pandemic. So in nutshell, I would say that India requires comprehensive crisis management strategy where a whole of society approach is required with joint plans, operational structures, and institutional guidelines for security sector with clear legislative and regulatory framework which needs to be drafted. Further, training and simulation exercises need to be conducted. And most importantly, transparency, as was spoken earlier also, is a must because that builds up the trust and helps in building up the confidence with the police. Thanks.
Thank you, Dr. Roshan, for your presentation. I will give the floor to Mr. Nabi from Pakistan.
Right. Thank you very much, Upasana. I congratulate Mr. Albrecht and you for arranging such a comprehensive webinar with very talented speakers and very knowledgeable speakers. Before I start my talk, I would like to point out two aspects which are a colonial legacy. The first one pertains to such epidemics not being new in Sindh. For example, since 1843, when Sindh was conquered, cholera and typhoid claimed so many lives, many village population were wiped out. This continued right up till 1880, 1890. The next was influenza, which between 1915 and 1925 wiped out many villages. All this is in the memoirs of the British Police Office. But the worst was the plague, which affected entire India, and Sindh then was part of the the Bombay Presidency. The plague was so severe in the Bombay Presidency, including Karachi and other towns in Sindh, that they had to create a plague police. It was a small unit, just about 100 or so, but they did wonderful work, which was mainly confined to social distancing, quarantine, etc. Because in those days, for example, in Karachi, ships going for Hajj or Umrah, the risk was of the plague spreading. So this was a problem very well solved by the police. Now coming back to the current day topic, one aspect which I find which needs to be pointed out is the degree of increase in the militaristic training for the police. Since 9/11, there was certainly a requirement for giving them commando training, militarized training, and equipping them with better weaponry and giving them all sorts of counter-terrorism techniques. But the unfortunate aspect is that all this took place at the expense of practical police work, which was incorporated earlier in the training manuals. For example, elements of law, for example, community policing, for example, gender issues, for example, public dealing, prosecution work, building up cases. This was an unfortunate aspect which gathered momentum, mainly because the pay scale for those trained in commando tactics at, for example, in Karachi, just outside Karachi at Razakabad, we have a very efficient commando training school. Anyone who completed, a constable or head constable who completed training from there on commando tactics, on counter-terrorism, etc., got a substantial extra allowance. And this encouraged the constabulary to go for those courses. The end result is that this militarization or this sort of training lessens the importance of civilian training, or how to deal with women, how to deal with communities, how to deal with trade bodies, etc. This is one aspect which needs to be pointed out. Another thing, I think General Muniruzzaman has given a very comprehensive account of some of the shortcomings of the police. I find that Similar shortcomings are in the Sindh police. However, in some cases, they are of a lesser intensity. In some cases, they are of bigger intensity. As far as corruption is concerned, I would suggest that all the participants must read a research paper written recently by Zoha Wasim, which is Policing the COVID through Procedural Informality. I've read it and I find whatever she has mentioned through research and a comprehensive research, all of it was what prevailed during my career, early career in the police. 36 years out of 36 years in policing, I spent 25 years in Sindh, the rest in Islamabad with the anti-narcotic force, Ministry of Interior, etc., Federal Investigation Agency. She mentions that because of the absence of the government in the problem of disbursal of funds, the government functionaries, the seniors, it can be a chief secretary, it can be a finance secretary, home secretary, or through them, the message goes to the police high command. They expect the police to comply with orders. Such orders can be arranging arranging face masks or sanitization equipment or various transports for carrying that, with the understanding that when the budget will be sanctioned, they'll be paid. The unfortunate aspect which I realized during my early career from an assistant superintendent of police right up till the superintendent of police was that such promises are made. Ultimately, the amount disbursed is just 30-40% per 60% with a time lag of 4 months, 6 months, etc. This brings me to another issue, the procedure of formulating police budgets and the procedure for disbursement of funds. This is a major cause which gives a bad reputation to the police. It starts with the police initiating a schedule of new expenditure. It goes to the Home Department. 2 or 3 weeks are wasted in the Home Department. They send it after making some corrections, etc., modifications, they send it to the Finance Department. Finance Department has so many agencies, they sit on it for about 2 months. Ultimately, they approve certain aspects, incorporate in the budget. Very often, 30% is accommodated, very often 80% is accommodated. Nevertheless, they decide how much to give and what amount to give. Once the budget is sanctioned, the next major problem is the Office of the Accountant General, Sindh. For every bill that has to be released or checks released, we have to initiate a case, a billing case with the Accountant General, Sindh. Very often they object, very often they sanction the total amount, they disburse the total amount, very often they initiate cuts in it. The net result is that the payment given is about anywhere from 3 months to 6 months late. This aspect especially was extremely detrimental in cases where we had to pay amounts for those who died in the line of duty, the shaheeds, the police shaheeds. And we raised the hue and cry. Ultimately, a revolving fund was created. A similar situation exists in the COVID crisis. If you read thoroughly Zoa's article, you will find that in virtually everything, the stress was, and this is a Urdu and a Hindi word, jugaad, how to accommodate which police officer at the level of sub-inspector or inspector would say no to the finance secretary, chief secretary, home secretary, or the IG, or the IG. Chances are, for some time, he may be suspended, he may be removed to a lesser important job, or there is a remote chance he would be dismissed or retired, something like that. So what the police personnel do, especially from ranks from ASI to inspector, using procedural informality, which means they call tax, which means getting things done. For example, a factory owner producing face masks, they'll say, please give us some, say 10,000 would be given free or 5,000 would be given free, another 500,000 would be given on loan, to the effect that payment would be made. Ultimately, perhaps some payment is made, which covers 30 or 40% of that. The police officer gets a bad name in all of this. The police department, the police personnel hire trucks, they hire Suzukis, they hire pickups with the promise that payments will be made. And ultimately, the budgetary constraints of the disbursement of funds are so little that payments are not made. On the one hand, the police are the frontliners dealing with the crisis. On the other hand, they are always invariably getting a bad name at the end of the crisis because the general public or the factory owners or whomsoever from whom they have obtained the goods and services complain. They feel that the police has gobbled up the items, which may not always be true. So this aspect is required to be clarified, assessed, rectified by the top government echelons in the provincial government, especially the finance secretary. The requirement is a meeting, a conference, and comprehensive meetings between the IG, Home Secretary, Finance Secretary, and the Chief Secretary on how to resolve such issues during a crisis such as a pandemic. There are ways of doing it. One is drawing money on an abstract bill, but the finance department discourages it. The other is initiating a revolving fund. This had been done in the case of policemen who died on duty. A similar case can be done, and it can be kept for future crisis of the level of the present COVID crisis. Having a revolving fund, for example, in the next financial year, 2021-22, if things are not as severe as now, the fund will lapse, which means the amount will go back to the provincial government. No harm done. But if it is there, the delay of 2 or 3 or 4 months will be avoided. So this is one aspect which brings police a bad name, and the lower ranking policemen can't explain it to anyone because it's orders from the high command. This is one aspect which needs to be transparent, needs to be rectified. The other aspect is there's a chronic shortage of police manpower. In certain police stations, there may be some surplus. In certain police lines or in the reserve police, there may be some surplus. But if there is such a shortage, the question is, has the police department tried other sources? For example, we have the police Qawmi Razakars. Since I'm an old timer, my last posting, the second tenure as IG Sindh, was till the year 2001. After that, I was in Islamabad. Is the police Qawmi Razakars organization is still working? For every day they perform duty, they are given a small amount. Again, it is disbursed after 3 or 4 months. But the institution, if it is still there, they can be utilized. Then there are the scouts. For example, the Aga Khan scouts or the Smiley scouts. If nowhere else, they can be used where Aga Khanis reside. For example, in Karachi, there are 3 or 4 places where most of the Aga Khanis reside. They can be used there. Then utilization of trusts and philanthropic organizations, such as the most famous here is the ED Trust, the Chippa Trust. Between the Chippa Trust and the ED Trust, 80% of the dead bodies are carried to the mortuary by them. 80% of the washing of dead bodies is done by them. Carrying them to the graveyard is done by them. Are they utilized in the COVID crisis or not? Then there's the Salyani Trust. They feed the homeless and those who are without jobs. And I've seen on the footpaths, not in thousands, but say in 50s or in hundreds, poor people getting fed. For example, at times there are unemployed and unemployment ratio is very high. Have they been tapped by the police or by the home department or whatever? If this can be done, there's a reasonable hope that the perpetual shortage of funds and the perpetual shortage of manpower can be resolved to some extent. The other thing which is many officers, police officers have complained, and I've discussed it with them. And this is also highlighted by Zoa Wasim in a research paper. The complaint is that police personnel felt that they were kept out of policy decisions, they were not consulted. If such complaints are being made by senior SPs or DIGs, I agree with them. But if such complaints are being made by assistant sub-inspectors or inspectors, I don't agree, because when policy decisions are made, the topmost criteria is the chief minister holds a conference or a meeting in which is attended by the chief secretary, the inspector general of police, the home secretary, the finance secretary, the secretary to the chief minister, and the DG rangers. They evolve a policy. Next, the home secretary holds a meeting and similar policy decisions are made. The commissioners in the division hold a meeting in which DIGs, the director, I forgot the secretary health. The secretary health also attends the chief minister or the chief secretary's meeting. At the commissioners meeting, the DIG, the director general health, the special branch, the Sindh Reserve Police, all of them attend the meeting and they are briefed on the policy. It is their duty to explain the entire policy to the ASI sub-inspector and inspectors by calling them for a meeting or a conference in the conference hall, or by calling their station house officers, briefing them repeatedly and telling them to brief their subordinates. However, there are at times when SPs and DIGs are not kept in the loop, but these are rare. And I think such lapses are bound to occur, but there are ways and means of trying to eliminate them. Another aspect is coordination within the departments which are, or the stakeholders which are affected. For example, between the police and the health department. One aspect through which coordination can be increased and with no cost, in normal times, at least during my days, we realized that we have a substantial network of wireless and we have spare wireless set. If it is possible in a crisis in the future, can we install a base set at 4 or 5 of the top government hospitals? For example, in Karachi, there's the Wasi Shahid Hospital, the Jinn Hospital, the Civil Hospital, the Civil Service Hospital. If such a wireless set can be installed, 2 or 3 more wireless sets are needed for the DG Health and the Secretariat. This way, they'll be in constant touch and coordination with the police network. And many lapses or delays can be avoided. Within their own chain of command, they can proceed much better. An objection can be raised that with the availability of mobile phones, we don't need this. My suggestion there is at least landline phones get jammed very often. Mobile phones at times are engaged all the time, or the conversation keeps on getting clogged with the result that normal communication is not possible. If the police department can be generous, this can be done. There are many other aspects of improving coordination with the public, especially. There are so many trade bodies in Karachi, in Hyderabad, in Sakra. I've attended the meetings, I've called them in my office. In those days, for example, there's the Federation. There's a very important office in Clifton area in Karachi, the Federation of the Chambers of Commerce of Pakistan. Then there's the Karachi Chamber of Commerce. Then there are the individual chambers. For example, the Karyana Merchants Association, the Paper Merchants Association, the Grain Importers Association, the Firearm Importers Association, at least I know of at least 30 to 40 associations where the office bearers are so keen to get involved in activities like this. I remember that in my time, I gave a talk in the Karachi Chamber of Commerce, and the next day there were at least 20 such senior ranking trade chambers officers who came to me and they said, we want to work with you. And can you issue some guidance to your subordinates to coordinate with us? We did that. And there was a tremendous improvement in the coordination. Then we have a unique...
Nabi, I'm sorry to interrupt you. I think all your points are very relevant. We're just a little short of time. So we have So I
one aspect only.
yes, please. You have 2 more minutes to conclude.
Right. One aspect. We have a unique institution, this Civil and Police Liaison Unit, Citizen Police Liaison Unit, the CPLC. It has done a remarkable job. The police fed them on police data because of the shortage of experts on computerization software hardware. We relied on the CPLC. They developed such a massive and such good software that even the police utilizes it. Their data bank is far better than any data bank of any police agency here. We can utilize them. They are very, very enthusiastic in assisting the police in such situations. We must do something. Then the element of transparency and accountability. The Police Complaints Authority has become a toothless body. It should be activated so that real accountability takes place, rather than depending on the National Accountability Bureau, the FIA, the anti-corruption, which the investigation is so much delayed. Complaints made to the Police Complaints Authority can be dealt with very well, and drastic action can be taken by the IG. So this is what I wanted to say. Thank you.
Thank you so much, Mr. Nabi. I think all the very detailed interventions that you have mentioned in terms of improving the security sector governance of Punjab or Sindh police in Pakistan is very commendable. And as you are our, our representative in Pakistan for carrying out the police work and other security sector governance. So we'll be engaging with these dialogues more intensely in the coming months and years. So thank you very much. So with that, without any ado, Indika from Sri Lanka, who's also our SSG expert from our network, would give a presentation. Indika, can I just request you to be brief?
Definitely.
Thank you.
Thank you. I'll be extremely brief. Public health emergencies pose special challenges for law enforcement, whether the threat is man-made or naturally occurring. So in these situations, policing strategies will vary depending on the causes and level of threat, as well as the potential risk for the responding officers. And in public health emergency, law enforcement will need to quickly coordinate with response with public health and medical officials, many of whom they may have not worked previously. So this is a significant issue. And in doing so, and with the new changes, I wish to flag this model which was created by Luke Bonkiewicz and Barry Rubach, the model which discusses about the shift in the roles and different styles of policing, where from the legalistic to watchman, and from watchman again to the service oriented. So these three different roles, and how these three different roles shift from time to time depending on the need. So this kind of a model could be thought of for the strategizing of the police service. And I know that our experts on the subject would come up with their own models as well. So in such, some of the other challenges we could definitely need to deal with are the community relations, what kind of community relations the policing would get involved in, and how does the these situations could deal with the communication, especially on the fake news. And in this post-truth society, fake news plays a major role, and politically it is being used. Sometimes it is being used against certain communities, certain regions, certain countries. So in such, how do we deal with communication? And psychological and health related well-being, how do we deal with that? And resilience and coping up strategies within the services as well as the related parties, and on support as well as the leadership. So in doing all these issues, how do we deal with the situations? And other problematic areas which were newly found were the new types of corruption because of COVID. Other than the traditional corruption methods and ways and means, new areas have emerged which needs immediate attention. And again, the militarization, there is a view that even in Sri Lanka, the militarization of policing and civil work has been increased. So there is a view and there is allegation as well as the practical situation is could be different. So that element needs to be discussed. I think it could be common in some other places also. And discrimination or scapegoating towards certain communities because of the COVID responses, or because of saying that these are the super spreaders. So different ways and means of scapegoating had been used, and it has been politically motivated also. So some political parties or groups are benefiting from these things. And other general areas are the staff shortages and the absentees in these situations, and lack of proper disaster preparedness, and potential standards and performance maintenance in the situation, how to maintain the proper maintenance of standards had been a critical issue. And the support in relation to equipment and supplies. So sometimes the most needed supplies, especially these days, the vaccinations have been a major issue. And I think rather than national, it has become an international issue as well. And the whole, this concept of vaccination, colonialism, a new concept had been coined around this. So this kind of issues, as well as outsourcing police duties, sometimes outsourcing these to military, as well as in some contexts, the idea of outsourcing it to some private security contractors. So these are also some areas which needs attention. And most importantly, the interagency coordination. Sometimes certain bureaucratic red tapes make things worse than make things easier. And the most important thing is the learning from past disasters. As our learned friend who spoke previously said, there had been a lot of previous experiences where we could have learned. So I just made an express way out since the time is issue. And thank you, Upasana, and thank you, Albert, for the opportunity, and thank you, DCAF. That's it.
Thank you, Indika, for your sharing your point of view on the security, the way forward to security governance. It was quite express, but I think you covered most of the important context for Sri Lanka. With that, I will now give the floor to Roderick Jarman, who holds over 32 years of experience in the Metropolitan Police Service, United Kingdom, and he is also the deputy to the Assistant Commissioner for Frontline Policing and Director for Leadership and Learning. He is currently leading also the police education and research at the University of London, West London, and has implemented the police education qualification framework with the College of Policing. So floor is yours, Roderick, and thank you for being with us today.
Yes, thank you. Thank you for having me. I am going to also be as brief as I can, and as I'm sure everybody can, this is such a large subject that it is very hard to condense it. And I wanted to focus on what was the way forward, the future from what we have learned. So within the University of West London, working together with the British Council and the International Police Association, we held a series of workshops and conferences in the latter part of 2020 to look at what the themes were that were coming from across the world, and to try and move that forward into some thoughts about the future and what we might do. And we involved countries across North and South America, the majority of Europe, from Kenya in Africa, Australia, New Zealand, China, Cambodia, and Thailand. So we had quite a wide group of people. Over 300 police organizations were involved. And I'm just going to very quickly explain what came from that, and then that shows where we are going to in the future in our thinking. So I suppose that the first and most important thing was this shared experience that in almost every country that we were involved, the experience of the police was very similar. And I think it all evolved from a point that was made earlier on today about preparedness. The health crisis on the UK resilience map, the idea of what are the biggest threats to the UK. Pandemic has been the #1 threat for the last 10 years. The World Health Organization and the United Nations have had it as a #1 threat for many years, and yet we seem to be exceptionally unprepared for it when it actually came. And that's probably, I think, because we thought about it as a health crisis rather than thinking about it as a crisis for society, about how things were governed, run, how we actually cared for people, and how we ensured that society was able to respond to something. So the things that came out for us was a change in the policing role, this move into health prevention. But I have to be very clear that from our experience and from the experience of our delegates, this was not a change from one form of policing to another. This was an added set of responsibilities. Crime in the UK has gone up during the process. Calls to the police have gone up. So there's no balance. The type of crime might have changed slightly, and some of the behaviours of people have changed because of lockdowns and controls. But generally, crime is in the same sort of place as it was before. And that means that police have had to think about this new role about preventing the infrastructure that allows the virus to move around freely. The other big change in policing was around procurement. In the UK, there was a requirement, and we've heard it just recently, about purchasing and procuring PPE. The UK police had to come together, whereas normally they work as 43 different police forces. Big changes in the way they were thinking about things. But in other parts of the world, for instance, in Peru, this meant building hospitals for their officers. So a massive change in the thought process at a strategic level about what police were doing at a time when police were actually being thrown into the forefront of their role as law enforcers. We've heard a bit about changing crime and social behaviour, particularly around harmful practices. Right across the world, an increase in an understanding of domestic abuse, but also a number of other harmful practices, predominantly against vulnerable people and disproportionately impacting upon women and girls, and the need to actually think about that coming to the forefront. And I was really enjoyed the thought of talking to not talking to power so much, but talking to this group of people and providing them a service, and the importance of that in the way forward if we are going to take the community with us in the things that police have to do. And of course, this big change in digital aspects. This was not just about digital and cyber crime and the greater use of computers, but also how many policing services have moved into being delivered through computers. So, for instance, we're responsible for police education in London. New recruits, much of their training has been online, has been through processes like this. Much of our community engagement has moved to requiring people to talk through digital processes. So these sorts of big changes, and they've happened very quickly, have been going on within this framework of a change in the policing role. So it's not just the role, it's how we deliver policing has changed. And then we've had this big strain on community relations. So some of it, like the Black Lives Matter debate, which was probably an amalgam of years of strain and stress in police relations with particularly communities, but also was to do with the fact that certain communities were disproportionately being impacted by the virus. Those things came together, and people's connection with society, their belief in the systems, began to break down. And we've seen that continue through, and the last few weeks in the United Kingdom, for instance, we've seen quite difficult debates and discussions around the role of the police going forward, and quite violent scenes on the back of it. So that's what we learned from what was happening across the world. And what I wanted to talk about was sort of three things: effectiveness, responsiveness, and decision making to some degree. So I'm just going to run quickly through those and what we thought of as the way forward. And we did this within the framework, and I think we've heard this talked about as moving from an enforcement to a service type provision. But the primary object of police being measured as the absence of crime and disorder. This is going back to Sir Robert Peel in 1829, and is still held up in many police forces as the starting point. So this, rather than measuring what the police do, measuring an outcome in terms of reduction of crime and disorder. And on the other side, the public are the police and the police are the public. This thought about the police being not something separate from society, but something that's part of the community. Now, we sort of, looking in all of the work that we do, think about this as this public-police relationship being a measure of police integration with society. So the more integrated the police are, the more public think the police are on their side. And the absence of crime and disorder being really a measure of social governance and control. So the more organised a society is, the less crime and disorder you have, the greater lack of social control, social governance, the more crime you have. And that works at a very local level around antisocial behaviour, but also works on things like serious and organised crime. So right across the spectrum, these are the sorts of things that we are trying to address, and trying to take the opportunity of the learning of the last year to improve policing for the future and security for the future, rather than it just being about the problems. So when we talk about effectiveness, the first key issue for us was we have resilience hubs in the UK. So we have quite a complex interoperability model, but that model is based upon it being a health crisis or a major disaster or a major issue. It does not really think about the impact of all of these dynamics upon how society runs. And in the future, we do need to think about a much more integrated approach to designing response to these very large and complex issues. So at a political level, we may see government departments coming together at the very top, but that has to run all the way through organisations right down to the frontline delivery. And that requires interagency communication at a very, very local level, and also coordinated action. So the thought that you don't just send the police to deal with something, you send a multi-agency team effectively to deal with something is a more effective way forward. The other one, sort of key area, was around leadership. The real importance to focus on the long term. So if you just think about what's in front of you today as what you've got to deal with, you're not going to get out of this. You're just going to continually fall over the next disaster. So this is sort of building an understanding of what the future is going to look like based upon your best guess of the future, and giving that as a message as to where we're going towards. So instead of us thinking we're going to have a return to normality, actually we're not going to go back to the way the world was before, because there's lots of good stuff around, you know, the use of digital stuff, for instance, and our learning around harmful practices that we want to take with us. So we need to keep that forward momentum. We need to be thinking, where do we want policing to get to? And that needs to frame the discussions around what we're doing. But at the same time, we can't forget that we are still in the middle of a pandemic, and there are things that are driving us today. And this is leaving no one behind. I think that the last speaker was talking about vaccines and the issues around it. The need to have a real clear worldwide approach to dealing with this issue. We can't just look after our own countries. We have to integrate this together and think about how all the countries work together. Otherwise, we're going to have problems around different communities and different people relationships. And the last thing was about sort of crime control, and I was really taken by a conversation earlier on about Nepal and the thinking about the criminalization of people gathering together, how significant an impact that has been upon society, and how difficult it is for the police to actually manage that. So I thought it worthwhile very quickly looking at a crime management model. This is a fairly basic one, but a one that came from all our research, came quite widely thought about across the world. You have a crime problem identified. You think about routine activities, so vulnerable victims, motivated offenders, insecure locations. You think about what you're going to do about that. You think about rational choice, so from an offender perspective, what are the gains and disadvantages of them committing crime, and how do you reduce those? You're probably going to come up with something around hotspot patrols, because that seems to be one of the most evidenced approaches to reducing crime. Is, you know, developing now with crime harm index, so we know that some crimes are more important than others. And from all of that, you come out with an intervention which hopefully deals with your crime problem. And this is a fairly normal model, and it's a model that we heard from Sweden, Ireland, the UK, Peru, Australia, New Zealand, and China was the type of model that was being used to deploy police resources within the pandemic. And it seems like the natural thing to do, because the police are responding to people failing to comply with the laws and therefore committing crime. But what we are effectively doing is criminalizing people for things which, within human rights, are probably fairly normal thought processes, and the long-term impacts of that need to be thought through. This is a different model, which is a social governance model, which is about setting the framework within which people don't want to commit crime. So you do this through social influence, social meaning, and social norming, which is basically people having a clear understanding of how they should behave, what's expected, and people being rewarded for behaving in the right way. And as a result, honest people feel safe, criminals don't commit crime, the community feels like it's in control and criminals are in check, and you have a degree of orderliness. So this is a more long-term model, which is thinking about how you structure governance approaches. And it seemed to us from the work that we were drawing that this was probably a more applicable model in terms of dealing with the pandemic than the criminal crime control model, which is the one that was seen to be used quite widely. So we have this sort of responsive approach, and thinking about that in terms of prevention versus response. So you respond to where there are issues of people not complying, or do you prevent people from not complying in the first place? And that has quite a dramatic implication are on perceptions of legitimacy in police. So generically across the world, there is quite wide perceptions that the police are legitimate when they are dealing with serious crimes, things that are expected and things that have just happened. So if you're investigating a murder, police get very high levels of support in almost every country in the world. But the more you get into preventative work, the more you try to prevent things from happening, the less the connectedness between the police action and that perceived crime is, the greater the issues to legitimacy. And what we have seen in the COVID world has been us trying to do something which is potentially stopping an infection happening, as opposed to people chasing a crime which they can physically see and understand. So there needs to be a very clear link between action and that is anticipated outcome. And that is probably more to do with communication than anything else. So the more we get into this preventative work, we have to make sure that officers have a clear message as to what they're doing. And if we took those two models I showed before, the one on the left, which is the one which has been used quite significantly, is more about crime happening, a crime problem is identified, and the one on the right is much more about a long-term preventative model. And policing needs to find its way between those two models and also be able to explain that to the public clearly as to what it's doing. And that only comes from good communication. We heard a few speakers talk about the role of the media and the way that the police actually present themselves. Well, this is a key aspect, and in countries where they've been particularly effective, there has been a very clear media strategy involving the police at the front line. And the other responsive nature that we think needs to be different in terms of policing is this concept of service, which we've heard talked about this morning quite a bit, which comes mainly from how the police and the public perceive themselves. So the closer the police are to local communities, the more that they've informed them of what is happening and what they think they need to do, the more they've engaged them in trying to come up with solutions. And critically, how the local public are involved in both decision making, but also in action to deal with issues. These key issues change the service nature of policing, the responsiveness of the police to what is needed locally, and they also give you the opportunity to deal with perceived and actual unfairness, because the more you talk to people and understand why they think they are being treated unfairly or why they are being treated unfairly, the greater the opportunity you have to put it right. And then that brought us on to decision making. So I've talked a little bit about social disquiet. We had key issues around social disquiet across most of the world last year, and it is still there at the moment. We have issues with terrorism, and we have issues with demonstrations becoming violent, and the police response to these needs to be robust, but we need to be able to differentiate between a demonstration which is criminal and violent and a demonstration or a public gathering which is people coming together for some other reason. When they become blurred together, we saw in the United Kingdom 3 weeks ago where a vigil was seen to become a demonstration, and at that point the policing response changed quite considerably. The feedback from the public, the public disquiet with what the police response was significant, and that is a real issue about getting that balance right. We also know about decision making. We've got to work out ways of dealing with more demands. That means yet further rationing of police response to crimes, and if you don't communicate freely why you're making those decisions, why you are focusing on certain issues, that leads to a problem with your feelings of legitimacy and your control of society. And the other thing which I think is really important, which has not come out that clearly in the public domain, I don't think, are the factors of personal risk for officers and emergency workers. We've talked about PPE. I've talked to officers who locally who have recently had to change their role from being police officers to actually going to do body recovery and body recovery of people who are infected with COVID. The long-term impact of that upon officers, I was in the workshop yesterday about mental health, but the long-term impact for that, for officers, but also for fire officers and for the ambulance service, are really significant. And if we don't actually build that into our decision making now and start thinking about that for the future, we will have a real issue about what's happening. And the other factor is this sort of political, I've been very critical in the UK around political governance moving from you're being too tough on people to you're being too soft on people. So you're either allowing people to come together when you should be stamping it down and giving them penalty notices, or you're actually and you should be taking more evasive action to stop things. So those will affect decision making going forward. So there's more demand, the social disquiet and these factors are things which we need to build into the way forward, because if we don't, we will trip over them as we move through the next phase of recovery. And the way to do that is better communication. We've had lots of conversations about this morning, so I don't think I need to go over that again. Greater openness, so gathering, analysing information, and a lot of discussion today around perceived natural corruption and police wrongdoing. Where police wrongdoing comes to the forefront, suddenly it is a much higher risk to services. We've had a couple of issues in the UK recently of police officers committing serious crimes. And instead of it being about individual police officers committing serious crimes, it's become about failures of the police to deal with things. And that is a real issue as we go forward. And then we need to be much more structured in how we deal with decision making, a greater conversation about action, the outcomes we're aiming for, the feedback from the public as to whether we're getting those outcomes need to be much more open and much more structured and formalized. So if you just sort of summing up on all of that, the thought process is around being more effective through taking the learning that we've actually gained about new processes and use of technology, being more responsive, thinking about how we actually respond to the public, and then making sure that we're clear around our decision making as to why we're doing things and thinking about that long game as well as the short game. So in order for us to be at a place where we are thinking about these two things around integration and social governance and control, we need to be really clear about the risks that have been brought into the forefront around human rights, about our whole perception of what is important in society. We have seen a move away from a presumption of innocence into the issuing of fixed penalty notices, which is basically a presumption of guilt and people having to prove their innocence on a quite significant level in this country and in other places in the world. The long-term risks around those sorts of changes on human rights are really significant, and all of those have a massive part to play for policing. But I would like to finish by saying my thoughts are we have got so much positive stuff to learn from the bravery and the capability of our officers to go out there and deal with this difficult situation. Then we have to be fearful about the problems that it might rise. So thank you very much, and thank you for asking me to talk today.
Thank you, Rob, for your really insightful presentation. I think it does bring all the discussion that we have had for past 3 days together, and I think, as you said, that we will continue this dialogue even in the near months and years to come, to just improvise and take this as an opportunity to reflect on our police forces. With that, we come to our final presentation of the day from Mark Donoghue. He is currently serving as a Deputy Head of the Joint International Policing Hub and International Strategic Policing Advisor to the Home Office of United Kingdom. He today will share some knowledge and readiness learnings that he has had through the A.R.L.M. program, which is Asia Regional Law Enforcement Management Program, in relation to COVID pandemic preparedness, and he will also be sharing some outcomes from that study that he has done. So over to you, Mark.
Thank you, Upasana, and thank you everybody for the opportunity to speak. I'm conscious of the fact of all the presentations that have been made, and an awful lot of them will encapsulate some of the things that I'm going to speak about. So I'll try and be very focused and purely concentrate on the learning outcomes from the A.N.M program. For the benefit of participants, A.N.M is the Asia Region Law Enforcement Management Program, and it's an Australian Federal Police program for collaboration and networking and sharing of knowledge and training across the whole Asia region. So in respect of COVID, this has impacted law enforcement operations around the world, and it was quite evident that we were not prepared for the scale, rapidity, and the far-reaching impact of this pandemic. So as the world moved closer to closing its borders, organised criminals adapted their business model in an attempt to sustain illicit profits and their businesses. So new vulnerabilities continued to emerge during the global health crisis, and still emerging as we work our way through this. And the implications for transnational crime are significant. And law enforcement agencies across the world have a crucial role to play in contributing to the efforts of controlling not only the infection side of things, but managing community safety, controlling public order, and ultimately fighting and preventing crime. And using all the skills and knowledge that the police agencies have throughout the world. But actually, A.N.M was about bringing them together from Asia and understanding what were the commonalities between all those agencies involved, how they're dealing with the pandemic situation within their countries, and how that learning could be incorporated as a one individual learning opportunity to be shared not only across Asia, but ultimately to the Americas and Europe. And I'll touch briefly in respect how that learning is transitioned into the UK. So whilst there was an initial slowdown of transnational crime, and criminals adapted quickly to this situation, and they exploited opportunities. So the online risk have increased, and the scope of transnational crime has changed. And no law enforcement agency in the world is expected to be able to deal with the magnitude that we're actually dealing with at the moment. So there was a massive learning curve for law enforcement across the world as a result of this. But on the backdrop of this, you also have the health crisis side of things, where, as other delegates have mentioned, how do you police and enforce a health crisis? And ultimately, one of the key factors that came out of the program was that it was through engagement of a whole of society approach to deal with the pandemic, not just from a law enforcement point of view, but from a health point of view, a security point of view, a whole societal point of view, is how you actually deal with this problem. So how did this come about? So the Australian Federal Police, they have a heavy footprint in Asia. But they also have a very strong cooperation network and a capacity building network. So over the last 15 years, the Australian Federal Police has worked hard in partnership with the Vietnamese Ministry of Public Security and the Royal Melbourne Institute of Technology University. And over those 15 years have conducted 50 specialised programs focusing on crime issues and law enforcement cooperation. So these programs are known as A.N.M, and over those 15 years, some 1,336 officers from 38 countries have graduated from A.N.M. And each A.N.M program involves an intensive 3-week program, which takes place in Vietnam, with guest speakers from around the world. But it has a strong a strong foundation of trust, which enables impressive actions across law enforcement agencies within the Asia region, intelligence sharing, collaboration to disrupt transnational crime, including a multitude of criminal areas such as drug trafficking, cybercrime, terrorism, child exploitation, human trafficking, people smuggling, and money laundering. But it was against the backdrop of COVID that the face-to-face A.N.M program came to a juddering halt. So there was a collaborative approach in changing the focus on how to deliver a training program online, something similar to what we're doing today. But the focus would be about pandemic preparedness and readiness, sharing of intelligence, sharing of information, sharing of best practice, and then being able to move forward for the future in making sure that this learning is continued. And as Rod mentioned earlier on, making sure that this learning goes forward into the future so that we just don't stand still with potential other issues that may arise in the future. So the objectives for A.N.M were really to examine the challenges faced by law enforcement during the COVID pandemic, and to learn lessons of best practice and actions from other law enforcement agencies. And then to reflect upon these shared experiences and potentially prepare a plan for the future in pandemics and also major emergencies, such as issues in relation to climate change, such as hurricanes, etc. And then build upon that cooperation and trust between all the A.N.M partners. So ultimately, all of those officers involved have a network now of like-minded partners within various other countries that we are able to tap into, seek advice, seek guidance, and ultimately share that learning experience. So on the pandemic preparedness course, we had 49 police officers from 16 countries. And all participants were specialists in their own fields of policing, as I mentioned earlier, in drug trafficking, transnational crime, child sexual exploitation, etc. And the whole rationale behind this was to ensure that whatever learning was achieved, that it was shared. And it was shared for the benefit of all nations through a law enforcement capacity program. So what did it actually achieve at the end of all of this? So having coming out of the program myself, it identified to me and it ensured to me a strengthened cooperation and trust between law enforcement partners within those 16 countries, and then potentially beyond those 16 countries when those officers return back to their normal working patterns and normal engagement with other law enforcement from other areas and other jurisdictions. So it was a robust examination of the critical law enforcement issues during COVID, and an improved awareness and confidence to face the emerging transnational crime issues that have been emerging and continue to progress through COVID as we speak. So sharing the valuable goal insights, able to create a comprehensive picture of transnational crime and how to enhance leadership capacity and readiness in combating this, but also making officers aware of their own personal health issues to be aware of. Because although we are dealing with as servants of the community and dealing with serious issues, not only from a criminal perspective, but also from a health perspective, police officers and law enforcement officers all suffer the same as anybody else in society. And one of the big issues that potentially was coming out of this was looking at the mental health concerns that may develop over time as a consequence of dealing with the issues of COVID restrictions on a day-to-day basis. And ultimately, at the end of it all, it was an opportunity for A.N.M and the alumni from this group to be able to ensure that that collective learning is shared across the nations. So from an outcome perspective, We have the protection of national safety and controlling the spread of COVID being paramount. And that was one of the key factors across all the nations that were involved. So when we think we work in silos, and potentially in some areas we do as law enforcement, what is really, really impressive is that we are all dealing with the same issues, although dealing with it potentially slightly differently in our own countries. But ultimately, we're all dealing with the same problem. And from that, you're looking at the adaptability and the courage of the officers of law enforcement and all the partners that they work with in cooperation and being agile in tackling COVID and the criminal issues that are falling out as a consequence of this. And the other aspect that has been highlighted through the engagement of officers from the programme is the idea of compassion. So we're talking about enforcement and engagement with communities, potentially in a confrontational environment because of how COVID has changed society. But ultimately, for police and law enforcement, we are a compassionate organisation. We are there, as some of the delegates have already mentioned. We are community servants, and therefore that compassion should and has been highlighted as one of the key areas for law enforcement in dealing with COVID and dealing with society within COVID. And it's maintaining a vigilance in respect of you're dealing with the health crisis, but you've also got to deal with the issues of normal day-to-day policing that sit behind everything that we do on a day-to-day basis. The other aspect out of all of this, and it has been mentioned, is the accelerated technological process and the digitalization of police work. Across all the partners involved in A.N.M, this was one of the key areas that's been identified. And the likelihood is, and evidence would suggest, that this is going to continue in momentum. And we have to be prepared and agile enough to be able to adapt, to be able to take this forward and utilize it for our benefit within a law enforcement environment. So how has the transnational crime landscape changed against the backdrop of COVID? Well, everything has changed and nothing has stayed the same. You have, as I mentioned, the acceleration technological progress, but also that's evolved in a criminal environment as well, where cybercrime has become a serious issue, where criminals are actively utilizing the benefits of cyber technology to target society. Drug trafficking has continued, albeit slow at the very beginning. It has maintained its business model and continue to identify other areas of movement and shipment, whether that's coming from South America or Afghanistan and such like countries. But then you also have the issue of child sexual exploitation. And that brings me back to the digitalization side of crime. 2020 has seen the growth in volume of child sexual exploitation and images increasing on the internet. And it's a growing business model for criminals. And therefore, we have to be vigilant in respect of how we actually target and deal with this particular type of crime. In addition to this, we still have the old issues of terrorism. We don't see terrorism in the extent that we have seen it, say, as 9/11 and extremist bombings or the like. But what you do have is a growing extremism version, whether that's right-wing or left-wing extremism, which is utilizing the time to recruit and plan for what it's going to achieve once lockdown removes that level of travel, but planning does continue. And then ultimately, in respect of an awful lot of these criminal issues, you've got the issue of money laundering and how the illicit profits of criminality funds all this mechanism of criminal activity I've just mentioned, and also brings into sharp focus the element of human trafficking and how that feeds into the money laundering criminal activity throughout the world. And finally, in respect of that, the human trafficking tightly enmeshed with people smuggling. So that will continue as climate change issues change society in various parts of the world. and in potential areas of conflict where smuggling will ultimately introduce people to being human trafficking victims. So you'll be happy to know, against all of this, there is a consensus that we have to anticipate potential crisis for the future. And looking back, as delegates have said, learning from history, but actually utilizing what we've got now at the moment for the benefit for the future in anticipating how we're going to deal with crisis. Initiate proactive planning programs, understanding and improving our legislative and regulatory frameworks. And all countries have introduced similar legislation to be able to deal with COVID. Some good, some bad, but it's yet to play out as we move through society in the pandemic process. And then from law enforcement practitioners, preparing ourselves as people in, as I mentioned earlier, about our own physical well-being and mental health. And then keeping sight of our core business. So we're dealing with the health crisis, we're dealing with all the issues involved in that, but ultimately about protecting society, dealing with crime, dealing with criminals, and protecting victims of crime. Preparing procedures through, as I said, the accelerated technology program, which is here to stay. And finally, building partnerships and creating communications. These are key to ensuring that we have a robust system within each country, utilizing our friendships and partnerships with other law enforcement from other countries in creating a cohesive plan, not only to deal with the health crisis of COVID, but also to deal with the criminal side of things that will still remain in the background for years to come. Now, I would like to touch slightly on the UK side of things and moving the A.N.M findings into the UK perspective. UK National Police Chiefs Council and senior police leaders, when COVID developed, there was a requirement for a national understanding of learning and experience and controlling and bringing all that learning together. And that was under the program of what's called Operation A.N.M. And through that program, all the forces in the UK have brought together their learning that they've experienced throughout the pandemic, whether it's on a day-to-day frontline facing, dealing with victims or dealing with criminals, but dealing with also the other issues of dealing with the COVID side of things, whether that's in health protection, dealing with and managing large gatherings, dealing with PPE, personal protective equipment, and the strengths and barriers that this brings to a front-facing community policing engagement. So A.N.M has been fed into this, and as a consequence, it is now part of the learning psyche for UK policing. I've touched on it earlier. There are three key areas that have come out of this. Is the accelerated technological process, not only by criminals, but by law enforcement. The real need for interagency, collaboration, communication, networking experience, and the benefits of bringing that experience together. And finally, communication and engagement across all partners, not just law enforcement, but across the whole of governments and the whole of society, utilizing media to generate that one voice of engagement and basically bringing people together and along in the process, rather than having to battle and continually engage. So I hope you find that very quick run through in respect of A.N.M useful. The findings are available if anybody wishes to have sight of them, and I can produce them through DCAF. And I'm quite happy to take questions like everybody else at the end of the program. And thank you very much for the opportunity.
Thank you, Mark, for your presentation and sharing the A.N.M program and how it has been also implemented in UK. I think there's a lot of learning to be had from that. As you mentioned that about this study, we will be sharing the information of A.N.M and other presentations during these 3 days on our website. So anybody who is interested to learn a bit more or get some more information will be more than free to access that. We have we've got few questions, but we have to finish in 10 minutes, it seems. But perhaps we can take very quickly, we'll just quickly at least read the question and see if we can address them quickly.